Welcome. We haven't done this in a while. We've been a little busy with our Tulip Fest last October 20th, but it's great to see everybody. I am Susan Lust, Director of the Parkinson's Wellness Project, and we are bringing education, awareness, and social interaction to families and everybody living with Parkinson's, which unfortunately is growing faster than we really want. I want to tell everybody today, this is a meeting, so you have a choice to be seen and to be heard. We have 3 terrific speakers today, and I want to open it up to you asking questions during their talk at the appropriate time, as long as the questions are in line in keeping with our topic. And just know any personal questions, just know that you have to contact your own physician for specific diagnostic and treatment questions. So this is, hi, all my friends. I see all wonderful people that I know. This is the 4th in our series of PWP MD Lunch with Your Doctor. And this month, we're doing a lot of talks on preventing Parkinson's and preventing the progression of symptoms of Parkinson's. So one of the most easiest ways for us to be here is through a lot of our friends who support us. And those are the pharmaceutical companies who I am very grateful to get to know. And I want to thank Acadia and Kyowa Kirin for these programs that they're helping us bring to you. So thank you. You know who you are. But first, I'd like to introduce our speakers today. Let me introduce Dr. Stewart Isaacson, who I met a couple of years ago, and I'm very glad to keep up with him and all the good things that he's doing. He is the medical director of the Parkinson's Research and Education Foundation and director of the Parkinson's Disease and Movement Disorder Center of Boca Raton. And he will speak on emerging strategies of prevention for PD, along with, who I just met, Dr. Kellyanne Niotis, who is instructor of the clinical neurology at Weill Cornell Medical College and assistant attending neurologist at New York Presbyterian Weill Cornell Medical Center, specializing in Parkinson's disease and movement disorders. And she is here in New York on the Upper East Side. So we are happy to meet her as well. Before we start with their program, I always like to have a little appetizer, and that is with our new friend, who I feel very close to already, even though she lives very far away, Taryn Colin. So Taryn shows people that there are better ways of eating, resulting in people being less depressed, overweight, tired, inflamed, and bloated. Her own personal experience of transforming her health motivated her to establish the Transformational Clinic in 1998. Taryn looks at the whole person, not as a series of symptoms that have to be treated. She focuses on nutrition, good eating practices, exercise, and mental health. And she is just a hop, skip, and a jump away via the World Wide Web. So I do recommend connecting with her if you are thinking about changing your eating habits. She's based in Fairland, South Africa, and she is a functional medicine certified health coach. Today, she's speaking to us on reducing symptoms through nutrition. So please welcome Taryn.
Do you want me to start, Susan?
Yes, please.
Okay. All right. A lot of you I see as regular names here. We've been talking for quite some time now, but today I've got 10 minutes to discuss a few small things. One of them is, there's a lovely saying that says, don't let the entire staircase overwhelm you. Just focus on the next step. And this is what I want to encourage you with nutrition. It's not like you have to change your whole diet in 24 hours or anything. What I want to teach you tonight is that just small little steps can go a long way to actually changing your nutrition. So what I'm covering here is that there are a couple of things that I see with Parkinson's. One is you don't get enough water. Secondly, there's a lot of constipation and digestive issues. And I want to show you how we can actually change those. So the first thing I want to ask you is, with every single meal that you have, is let's try and add a few more greens into your diet. Let's try and add a few little bits of color into your diet. And don't go for the bottles, the packets, and the tins. Try and go as fresh as possible. I do know that a lot of you are on medications, and protein causes interactions. So you end up having your protein at night. But during the day, why don't you introduce my amazing green smoothie, which has an incredible amount of greens, because I actually want you to eat a ton of greens. I want you to fill your whole blender with greens, but I know that you're not able to do that. I mean, I can't eat that amount of greens in a day, but I can actually drink it. Because when you blend it down, it's actually a small amount of greens that you're drinking with a lot of water. And you put your avocado into it, you put your lemon, you put your ginger, and you put an incredible amount of herbs into it. So you've got a powerhouse of nutrition in one glass. And if you make 2 to 3 glasses, you could add them over 24 hours. It's not like you've got to make it every single day. Because I understand that, people are tired, people are, everything can be quite hard to do. So you make things that you've got for a couple of days. And if you put them at the back of your fridge and keep them really cold, you could even make a ton of smoothie and actually freeze it into small portions and actually put it in your freezer and pull it out every day, so that you're not doing this every single day. And I want you to get in all your calciums and your magnesiums and your potassiums and your minerals and your iron, because a lot of people have iron deficiencies, is you can do this in your green smoothie. And then from a constipation point of view, is that I found with a lot of my clients, because I specialize in autoimmune diseases, is it's really that I see somebody with an autoimmune disease that does not have a digestive disorder. And one of the big signs is actually constipation. So I found an amazing vegetable that does wonders for constipation instead of using a whole lot of laxatives, and that's called beetroot. I don't know if anybody knows about beetroot, but when you put it into a blender raw and you blend it up with, again, put some blueberries in, put some banana in it, put a bit of avo, put lemon and ginger into it, and you drink it down, it actually softens your stool and is a wonderful, wonderful laxative. For some people, it can take a couple of days to work, especially if they've got a lot of backup. But most often it actually starts to work immediately. And of course, if it works too much and you end up with a bit of diarrhea, then you just pull back a little bit, use less beetroot. But it mustn't come out of a bottle. It mustn't come out of a can. It must be fresh. I don't know if any one of you guys have actually tried it, but I've got a recipe. Susan has got it, and she was going to put it up tonight. But otherwise, I'm sure it'll be put out on their website of how to make this beetroot smoothie. And Susan also has my recipe for apple delight, and you could add it to it just to give it a little bit of an extra vuma. But not only that, as I've put there, beetroot is high in calcium and iron and potassium and folate and vitamin A and lots of dietary fiber, which we need. Is a great prebiotic. So have a look at this recipe as something that you could maybe add to your diet. It's simple. It's simple to do. And again, as I say to my clients, is make a whole lot of it, freeze it into small portions and put it in your freezer. And when you feel like you're not going that well, just pull it out, let it defrost. Don't heat it up. Just let it defrost on its own and then drink it. I highly recommend that. Then something else that I've come across, and I actually sent Susan all the literature, there's been a lot of research being done into sweet marjoram. And it's with Parkinson's, with regard to Parkinson's. So the research is they've got very small studies done at the moment, but it's something to actually look at, because herbs are very, very underutilized, especially fresh herbs. your oreganos, your rosemaries, your thymes, these anti-inflammatories, the antibacterials, the antiparasitics, and people don't think about using them. They turn to the dry herbs. But this is one of those that I really would like you to try. You can buy the dry herbs. I'm sure you can buy it on the internet. Susan, you were saying that a friend of yours actually went out and bought some. You can actually try and get a fresh plant and grow it in a pot. And as I've put there, it aids with the indigestion and gas, and very, very good during with your coughing and asthma and rheumatic pains and toothaches, and again for Parkinson's with your non-motor symptoms, and of course depression. And I know it sounds weird, but it's not as good. It's not a cure-all. It's the same as the beetroot is not a cure-all, but it offers a whole lot of other benefits to doing it. There's no harm in doing it, but I do want you to watch that if you're on warfarin or you're on certain medications as blood thinners, that do be careful with some of these things because of the vitamin K in it, and because of you know, that things that can actually cause you to have your blood thin even more, that you don't want. So you can always ask me, you can always email me and ask me what you should be taking with medications. But I would really like you to try and look out for the sweet marjoram. If not fresh, get it dry, and you can make it. And I've given you the directions on how to do it. So by adding in small things, by putting a little bit of color onto every single plate that you have, by trying to add in as many vitamins and minerals in the form of vegetables, and keep your fruits to a minimum, but go for that color, go for that green. And you'll see your stomach will start to work just with all this fiber between the smoothies, the beetroot. Your stomach will start to work incredibly well. Susan?
That's great. That's great. You actually, somebody told me that they've been doing it for a couple of weeks now, and they can smell. It's helping with smell.
Yes.
So yeah, so it is inspiring. Just these little things make a big difference.
Yeah.
So thank you, Taryn. If anybody has any questions for Taryn, she'll be with us for the rest of the webinar. So send your questions in. I want to do just a little commercial right now for our workout. We expanded our studio in Pomona, New York. Not only do we have in-studio exercise, Rock City Boxing with Yuri, but we also have over Zoom with Alex Tresser and Cecilia Fontanesi. They're two amazing teachers. And we have people tell me, we have a staff of fantastic teachers. We want you to come to these classes. So all of our schedule is online, and please call me with any questions. Now, without any further ado, I want to introduce you to Dr. Kellyanne Niotis and Dr. Stewart Isaacson, who are going to take the screen from now and talk about preventing progression of the symptoms. So thank you for joining us today.
Thanks, Susan. Great to be here. I enjoy your group, and I brought along a guest today, Kellyanne Niotis, who's a movement disorder specialist trained at Mount Sinai and Cornell, and she has just returned to Cornell and in Manhattan to set up a Parkinson's prevention clinic. So something very special, I think, and something I think everybody wants to know more about. And we thought we could sort of talk about emerging strategies for prevention of Parkinson's disease progression to sort of understand what's involved in this. So Kellyanne, great to have you meeting all my friends here.
Yes, thank you for having me join. And it's really nice to be here and to talk to everyone, because this is something that is really important. And I'm glad that we're finally putting our brains together and focusing on it, because it is a need that is unmet.
It's really something that is really an unmet need, because it doesn't exist almost anywhere in the world. And yet here you are setting it up. What do you mean, though, by preventing Parkinson's progression? I mean, it sounds like such a great term, but what do you actually mean by that? You set up a whole program about this at Cornell. We're setting up one down here in Boca Raton. But what do we actually mean by preventing Parkinson's progression?
That's a really great and important question, and something that we should really define because it means a lot of different things. So for somebody who has an established diagnosis of Parkinson's disease or Parkinsonism, it could mean preventing the progression of the motor symptoms, but for a lot of people, the motor symptoms aren't the most bothersome part of Parkinson's disease. And for some people, the fear of cognitive changes or dementia is something that warrants prevention in this group. And it could be non-motor symptoms, a lot of things that Taryn touched on: depression, anxiety, constipation, things that really impact your quality of life. But for people who aren't diagnosed with Parkinson's disease, can we use clues from their history, their genes, to suggest that they're on a track to develop it and prevent the onset of the disease and the diagnosis of the disease? So it's a good question, and we're looking at all aspects.
So nowadays we have so many new research ideas on genes that can increase the risk of developing Parkinson's, and head trauma and family histories. And we know that Parkinson's may begin 10 or 20 years with involvement of other parts of the nervous system. When you meet a patient who was concerned about their risk of developing Parkinson's, or has just been diagnosed, or wants to know what to do to prevent it from getting worse, do you have a recipe that you give to everyone, or do you have to take a more personal, individual approach?
So unfortunately, there is no one size fits all approach here. And I think a lot of people would agree that a lot of the failure for development and progression in finding treatments for disease that can slow the disease down is that we've really looked at the disease as one disease, but we know that people are very different. The symptoms that they have are very different, and the things that may have caused their disease are very different. So you have to look at the person very, very closely, what risk factors they have, what their family history looks like, and really look at their blood biomarkers to see what path they may be on to develop disease.
So what are the types of things that you test for in the blood?
Inflammatory markers, lipid panels, vitamin levels, just examples. Other biomarkers like uric acid are things we look at, and not blood markers, but cognitive measures are also really important. So we do very, very detailed cognitive assessments just to see how the brain is functioning and what parts of the brain might or might not be affected, and can we change course there.
I know we've looked a lot at the genes in Parkinson's and Ashkenazim. We often have two genes that can increase the risk and actually cause Parkinson's. And we've now developed medications just for those genes that are in research programs. And with any luck, hopefully they'll work, and we'll be able to use these medicines to prevent Parkinson's in the next generation by fixing this genetic disorder, very similar to the story of BRCA, and how BRCA is involved in different cancers like breast cancer and all. And there's medications now directly for people with BRCA breast cancer as opposed to people without BRCA. We now have the same thing going on in Parkinson's. Turns out Parkinson's is another one in a long list of Jewish genetic diseases that, and we can now address that by looking at two genes. And if you have GBA Parkinson's or LOCK2 Parkinson's, there are new medications that are specifically for that. So that really changes things, and we know that it can influence the progression and our thoughts on how to slow the progression.
I think that's really important. And it is very important because if we can do anything now to delay progression by 2 or 3 or 4 years, that's really, really big, because in 3 years, things may look different in terms of what medications are available. So if we can slow things down as much as possible, and pump the brakes when something like that breaks through. That's really, really the key.
Been a lot of thought about this protein called synuclein or alpha synuclein, that we don't know what triggers this, but this protein may contribute to some of the neuron cells, the brain cells, not being able to make enough dopamine or degenerating in other parts of the body, where it can lead to constipation in the gut or low blood pressure in other parts of the nervous system. What do you think about this synuclein protein? Are there things that we can test for, or people can try to do to help this protein?
So, as we've learned from the fields of Alzheimer's disease, it's unclear if the protein is really the problem. Maybe it is, but maybe there's something before the protein that triggered the protein to develop that's the problem. So I don't know that targeting the protein specifically is going to change what has already happened. I think we have to dig a little bit deeper and start a little bit sooner.
Yeah,
But
this is
maybe.
a real challenge.
It's a challenge.
To start sooner. We have looked at 2 monoclonal antibodies that can work on alpha synuclein, just like, about the monoclonal antibodies that can work on COVID. And we've given them to people who were just diagnosed with Parkinson's to see if we can stop. And one didn't seem to pass muster, and one showed some promise and is being looked at now at people who take carbidopa-levodopa to see if it can slow disease at all. And there's actually a pill that can prevent that protein from clumping together. So we may get some answers as to whether it's useful or not. I think the jury is still out. There's a lot of research programs going on trying to slow the progression of Parkinson's as well, using different medications. So certainly people who are newly diagnosed, and if they're looking to slow the progression, there's things that are medication-based and some things that are not medication-based. What are some of the non-medication-based things that people can do?
I will answer that, but Susan, do you have a question?
Yeah, because I'm going back a couple of thoughts ago.
Yes.
The blood biomarkers. Do all movement disorder neurologists do that test?
No.
Do those tests? So that's what I would like you to address that. How would our audience follow up on something like that?
So most movement disorder doctors are seeing you and are trying to treat the symptoms that you're coming in there with. We are doing research. So we're looking at these markers in a more investigative role or function. And these are things that most places don't routinely offer. They're a little bit more difficult to obtain. You need special labs for it.
So would they come to you? Like they go to a movement disorder neurologist. So is that a department that you have, and how does your department work with outsiders who don't go to you as a doctor?
So we would screen and enroll in our research trial.
So for example, we found that in a trial that was done about two decades ago, that people who had the highest amount of uric acid in the bloodstream had a slower progression of Parkinson's. Now, before that, we always thought about uric acid as causing gout. Nobody wants gout. But it turns out that uric acid is an antioxidant. It's not only an antioxidant, it's the most powerful antioxidant that's known in the human body. So I know there's a lot of antioxidants you can take in foods and other types of supplements, and berries, but it's actually in our body, this uric acid. So we wondered, could we boost the uric acid in people who have lower levels and slow the progression? And one study said it looks promising, and another study said it didn't really work, but maybe it worked for some people, not everyone. Or maybe it only works when you do that and also do other things. And this is the challenge of what are those other things to do in combination. It's like saying my car isn't working so well, I put gas in it every time it gets empty. And you say, well, how about the oil? No, I do the gas. Well, you have to do the gas and the oil. And you better check the fluids as well and make sure the brake pads work. It's complicated to make sure the car runs smoothly. Same thing with the human brain. It may take more than one thing, but we tend to study things one at a time. So what Parkinson's Prevention Clinic can focus on is not only all the treatment options, but what are all the different things that have to be looked at to do all at once to try to hopefully slow progression or reduce the risk of having Parkinson's progress. And I think that's what this has, and what we're setting up here, and Kellyanne's setting up there, and we're trying to work together to identify what are all those things that we have to sort of investigate and then try to supplement or treat, but then we have to follow it. We have to look at this in a research-oriented way, or we'll never know the answer. And we want to know answers. And that's what's so important.
Yeah, another great example is B vitamins, which everyone has probably heard all about the importance of B vitamins. Well, we look at something called homocysteine, which is an inflammatory marker, and we look at a gene that affects the way that you metabolize B vitamins, because some people actually can't metabolize B vitamins in the way that is available in food sources, and they need a specific type of B vitamin for their gene. And so we really try to give people recommendations that are tailored to their underlying process.
And everyone's different. People who have a lot of cardiac problems or heart disease or cholesterol, we need to focus on other things to add in. People who have diabetes, we have to focus on other things yet. So everyone is different. We recently had some thinking of people who have autoimmune disorders, like rheumatism or other types of arthritis. As rheumatologists, we have to focus on other things there as well. So it's complicated, but it's the beginning of a new era of not only trying to treat problems when they occur, but trying to prevent problems that occur from getting worse or new ones from occurring. Even in Parkinson's disease, someone got Parkinson's disease for 5 or 10 years and their memory is good, but they may be interested in what can I do to reduce the risk of having memory problems in the next 10 years. We don't have an answer for that right now, but that's what we're trying to study in this prevention realm.
We have a lot of clues on what people that slowly progressed or never developed the disease, what their lives were like, how much they exercised, what did they eat, what were their diets like, what supplements were they on. But it's not good enough just to look at that. You have to actually try it in real people and the right person.
So explain to us again how people will work, how patients will work with you at your clinic to help with the progression.
What is a visit like?
Yeah, what is a visit
during
like?
a prevention visit?
Thank you.
Okay,
Susan
so
wants all the answers, Kellyanne.
yes. Okay, so the first visit is a lot about us learning who you are. How did you grow up? How did your brain develop? What's your family history? What's your diet like? What's your exercise like? What medications do you take? So it takes a long time for us to learn what symptoms you're having, what risk factors you have. After that, we do detailed body compositions, measure muscle mass, body fat percentages. We look at the blood work that I mentioned, genetic markers, and then cognitive testing. After all of that, we finally have a clear picture of you. We think we do, at least, a clearer picture.
How many visits is that? How many visits is that?
So it's one for the initial intake, and then one other visit to do the cognitive testing, blood work, and biometrics. And then we meet again to go over recommendations, what we think that you should do, how you should start changing your exercise, diet, lifestyle. And we check in 6 to 12 months and redo these things and see what progress you've made. And we follow it over time and adjust the plan accordingly.
And do you work with the movement disorder neurologist that they go to? You team up?
So I'm a movement disorders neurologist. So a lot of the people that we're seeing are earlier on in diagnosis. Most people do have a movement disorders neurologist, and I'm happy to converse and have conversed with them in the past. But for some people I see, they didn't know that they have Parkinson's disease. And I found it once talking and examining them. So I've acquired
So
Patient care.
someone who's seeing a movement disorder neurologist closer to their home,
Right.
maybe in Westchester or Rockland County, and wanted to come down and then be evaluated for this, would they still keep their movement disorder neurologist up in Rockland County or Westchester, or would they have to switch? Can they see you just for the prevention and keep their neurologist that they love already?
It's best to keep your relationship with your neurologist because they know you best. And I know from experience, it does take a lot to manage the medication sometimes. And that does require more than 6 to 12 month check-ins in some people. So it's best to keep both relationships.
Mhm. Okay.
But I also want to say I love what Taryn said, that it's slow and steady wins the race. You can't do it all, and little steps all make the biggest progress over time.
Any questions, anybody?
How
Where-
long does it take
oh.
to diagnose someone?
How long does it take to diagnose someone?
20 years. Because we think Parkinson's begins 20 years before the slowness and tremor occurs. It begins with things like constipation and trouble sleeping at night and vivid dreams and a loss of smell, sometimes low blood pressure when you stand up, and then sometimes some anxiety with some mood problems, some stiffness or shoulder pain. And then a little tremor comes here or there.
Well, that's just
And then
like
more
living
tremor
in New York.
comes. What's that?
All the symptoms is like living in New York.
Yes.
Yeah.
It sometimes is hard to figure out what is just a New Yorker and what's something more deep rooted, but I think we can sort it through.
So the later you're seen to see if you have Parkinson's, the less time it takes to make a diagnosis. If you develop tremor and slowness and you wait 3 years before you see, then it's be obvious. You're going to walk in and they're going to say, aha, that's what you have. If you just have a little tremor that comes and goes, it may take 6 months or a year to confirm that diagnosis. We have tests that we can use now. We have a brain scan called a DAT scan that looks at the dopamine transporter in the brain. That can be helpful early on. We have a skin biopsy that can look for that protein in the skin, a little skin punch biopsy on the shoulder and thigh and ankle. And this can help us with the diagnosis. And we have gene testing that can be done at no cost and anonymously that can look for genes that can help us know about this as well.
And Dr. Mishley has a dog.
Dr.
Yes,
Mishley has
there's
a dog.
right?
Yes, Coco is a beautiful dog that can smell different diseases in people. And a dog can help sometimes as well.
Yeah. We have a question here about environmental risks. Is there something that people need to do to help themselves not get Parkinson's, or is that a cause?
That's a really huge part, I think, in the development of Parkinson's disease and something that we are looking at. So these are very general recommendations, but produce, washing your produce and watching where it's grown, trying to eat produce that's grown in the United States or Canada is probably better because the pesticides are more regulated. So there are a lot of environmental exposures, some studies on well water and making sure that you're filtering your water, not drinking out of wells. Maybe there's some other environmental exposures there. So yes, and the environment does play a very big part in it.
We just asked Susan, is there something people can do to prevent Parkinson's or prevent it from getting worse? I think the answer is yes. We just don't know what it is. And that's why we have to evaluate as many people as possible in this new way, not just the medical way, but the prevention way, to sort of understand what it could be for certain people and learn that answer. So when we have this conference in a year or two, we can give better answers and know the answer. But I think there are definitely ways to slow this down. We just don't know it yet.
Somebody's asking, is there a way to help with the progression of gait freezing?
So we wish we had a great answer. We know that people who stay more active, who exercise every day, at least 5 days a week, who seem to do better, but we don't know if it actually prevents the freezing. We think that people who take their medicines more evenly and don't wait too long to take medicine, take the right amount of medicine to have good mobility, may have less freezing down the road, but we don't know that to be true. So sometimes we have to do what we think is best, but if we don't follow people to see, we won't know. And we want to follow things like freezing and memory and falling and swallowing, non-motor symptoms and motor symptoms, to know what can we do that's actually going to slow progression and what things only treat the symptoms but don't slow progression.
And just, I think it's also important to mention that there are people that we meet and we are able to diagnose Parkinson's disease really early. And for those people, there's always an option in other clinical trials in early PD that are open depending on what that person might want. If they want to continue just down the path of what we're doing, that's okay. And if they want to try something that's more involved, we're always open for that too.
Okay, we have another question here. Can the misinformed synuclein protein be diagnosed in the brain scan or the skin test that you talked about?
The skin test actually looks at synuclein. People without Parkinson's disease have a normal test, and people with Parkinson's disease tend to have an abnormal test so we can identify synuclein. In combination with the DAT scan or with clinical symptoms, it can help us make a diagnosis of Parkinson's disease, although other disorders that look like Parkinson's may sometimes have an abnormal skin test because they also involve the same protein and are like cousins. They share, but they're not exact.
And unfortunately, not all Parkinson's has alpha-synuclein. So there are some people who don't ever get alpha-synuclein. So it's just a piece of information that we can use. We also are looking at it in the gut. So people who are getting their routine colonoscopies, we're sampling alpha-synuclein.
Another question, what is the name of that skin test? So people could ask.
Syn1.
What?
Syn, S-Y-N, 1, O-N-E, Syn1. It's based out of Phoenix, Arizona, and it's seems to be covered by many of the insurances now. It's not a necessary test unless there's a question as to what the diagnosis is, nor is it a test that can tell us if things are progressing or not progressing. But we're making progress with some of these biomarkers to understand it better. So it's not a test for everyone, but for some people, it can be useful.
This is great that you're starting this program right here in our neighborhood, because it's really important for everyone to know that we can find out more and get more detailed information to focus on things for ourselves.
Long overdue. We needed to start this, so it needs to be done, and I'm really, really excited about it. I think it's something that a lot of people are interested in, and something I personally remember feeling very frustrated. I couldn't give people better advice when they asked me. So I hope that we're able to do that.
Is insurance covered by what you're doing? Even though they're seeing their own doctors and they come to you for this?
We do participate with certain insurances. And so, yes, the answer is yes.
All right, so you'll have to type your phone number in on the chat so everybody can be in touch with you.
Great.
Somebody's asking, so what does the SYN1 test actually indicate diagnostically?
So there's two different disorders, a lot of disorders, but Parkinson's disease is one that has synuclein. And there's a cousin called PSP that doesn't respond well to medication. It's what Dudley Moore, the actor who played Arthur in that old movie, had, unfortunately. But in PSP, there's no synuclein. There's a different protein. Well, if you weren't sure if they had one or the other, this test can help decipher that type of idea.
Mm-hmm. Taryn, do you want to join in this conversation? I'm sure you have a lot to say. Because they're talking about looking at the whole person, the whole picture with everything.
Yeah, I actually love it. I actually love it. I wish in South Africa we had doctors like you, for example, Kellyanne, to create this interaction with regard to nutrition, the gut microbiome, the MTH, FRG, looking at the genes, things like it would be amazing. Yeah, I don't have anything to add specifically, but I'm also very excited to hear what you're doing with regard to Parkinson's.
Thank you. Yes, this, like I said, a long overdue process, and we're in the perfect place to start this. We have an at-risk and affected population here, so there are the right patients.
Yeah. And do you look at the gut in any way with regard to testing and stool testing and checking for bacterias and yeasts, and of course all your digestive stuff and your secretory IgA? Do you do all of that kind of thing as well?
We tried to do fecal microbiome testing, and the company that we were using just wasn't good. So we're thinking about trying that again. We are doing some oral microbiome work and working with dental hygienists and people who specialize in oral health and oral health dysbiosis. So
Yeah.
Now learning that periodontal disease is really a risk factor for neurodegenerative disorders, and it might not be good enough for some people to get their teeth cleaned every 6 months. Some people might need more, and that might play a role.
Yeah, there's that saying of if your teeth are bad, you can be bad. You are bad. Your mouth is actually the gateway to the entrance to your whole biome. So if your teeth are, and you're not flossing properly, and you're not cleaning your teeth, even just doing that oil pulling with there's not a lot of research behind it, but using coconut oil and rolling it around in your mouth, just picking up bacteria and spitting it out. Susan, I've actually written an article about it. I'll send it to you and you can put it on there. Just to keep your teeth in good order is a start, is an incredible start.
What, to rub coconut oil on your teeth?
It's just, it's just an old sort of Ayurvedic thing of, I like my clients to take real proper coconut oil and add some oregano and some rosemary and some peppermint or tea tree into it. And they mix it, but keep it very sterilized. And once or twice a day, just take a tablespoon out. Whatever you do, please don't put the spoon back in again. And just sit for as long as you can and just roll it in your mouth and roll it in your mouth and spit it out. Whatever you do is don't swallow it. Floss your teeth, brush your teeth, and every little bit helps. As we were saying, that staircase, it's that starting at the bottom of the staircase, and every little bit helps. And it doesn't take a lot of time to do.
Right. So one of the problems that Parkinson's gives us is motivation. So we have to get motivated to do all these things. So how are you going to recommend that?
That is a huge, huge component. And I think it plays into the loneliness aspect. I think a lot of the mood and loneliness feelings really play a role in motivation. So unfortunately, I don't have a good solution for lack of motivation. I wish that I did, but I don't, other than social support, which is really, I think, but I don't have anything huge, groundbreaking to say about it. It's very challenging.
I can see from our group that we have a small group of our classes, and I can see over the years, everybody's responsible for each other showing up to classes, and whatever issues everybody has, everybody knows that they can get into the studio, they can work out with each other, they can talk to each other. And that connection, that social connection, I think that helps. Even if we feel like, I don't want to go there today, I don't want to exercise, but you know what? My friend's going to be there and I need to show up for her or for him. So that's very important that we continue these programs.
I agree. Everyone is
Susan,
different.
sorry, something that I do here is because most people are on WhatsApp is we form groups where you know, if you've got Parkinson's or it's, I've got one for my clients with rheumatoid arthritis, or and they motivate each other, and then we have a meeting once a month of what can we do for the next month, or you know, those kind of things that you're actually forming a group and you're forming a community where you know, we don't want a situation where you've got these everyone sort of revolves around all the negative aspects of the disease. Is that you're only allowed to talk about positive things and what you can do, who made, I mean, I'm on the nutrition side, so what did you put in your smoothie this time? What have you done for this week? What, you know, and I think that if you guys could actually form that community, little groups, just small groups, people on this actual platform right now, getting to know other people. Otherwise, it can be incredibly lonely to do something on your own.
Yeah, it's true. We need each other.
Yeah,
We do.
yeah. And you make a friend, and you know, you can make a friend.
Yes.
I mean, everyone could do with one more friend.
Absolutely. I just made a new friend of you. And you're all the way out the other side of the world. Right. We're on a great time zone. She's like waking up and I'm just going to bed. So
but you know, everything is possible. Everything is possible.
So Dr. Isaacson, tell us a little bit about your studio that you have in Boca. For people, snowbirds who go to Florida, they're going to have to come visit you, right?
We're always open. We're trying to combine this approach to having not only the new medicines, we have about 25 medicines to treat Parkinson's disease right away, all the research programs with 25 or 30 new medicines to try to treat other symptoms or better symptoms or find ways to try to slow it down, with all the wellness strategies of exercise and trying to keep the mind sharp and keep the swallowing sharp and keep the speech clear and all these types of things. So the Parkinson's Wellness Center that we've opened here, where we have daily lectures and activities where speech therapists and a social worker and support groups to try to give those types of things, and also combine it with trying to see if it can slow progression and monitor people who are in these things, because it's all part of the same thing. You know, we sometimes wake up in the morning and say, hey, I'm going to try to find a way to stop Parkinson's from getting worse. But it's better to also add, does anybody want to help? Because we can't do it alone. We're all in a partnership together with people who have Parkinson's, family members who want to try to avert getting Parkinson's, doctors and nurses and therapists and nutritionists and social workers who want to try to help people with Parkinson's. So we want to have a place where everyone could sort of work together and try to figure some of this stuff out.
Yeah. COVID really set us back for 1.5 years, I really think. And now we're just coming out of the closet now and getting together. And I think being together and seeing each other and talking face to face as opposed to in a little small box like this makes a big difference. So I'm happy to be out of that COVID box.
Absolutely.
Definitely.
Any more questions? And I think this is fantastic speaking to both of you. And Dr. Isaacson, I'm so glad you introduced us to Dr. Niotis. Now we have a new friend and so close.
Yes.
So any other questions? I think that that's our lunch break for today. I want to tell you that you can see Taryn's recipes on our website, and you can check out all of our classes there, and I hope you'll join us. You can try out one class for free, for sure. And any other parting words, Kellyanne, Dr. Stu, or Taryn?
Thanks for listening to us. And I am really excited that people are motivated to do something like this and are interested in it. And I'm happy we're all together. So thank you.
Wonderful. All right,
was
so
enjoying
everybody
the
sees
group,
Dr.
Susan.
Niotis's phone number here on the bottom, so just jot that down. It's 212-746-0226. And if you go to Boca, you can go to Dr. Isaacson's center. Hopefully we'll see you soon. And thank you, everybody, for coming. Next week, we have November 9th is Dr. Alcalay from New York Presbyterian. He's going to be speaking on a very important topic that you touched on today, because he's done a lot of research on the genetics. So he's going to be talking on the genetics of PD and converting risk to hope. This is all about hope. We have to be positive, like you said, Taryn. So thank you very much, everybody. Thanks for joining us today, and hopefully we'll see you next Tuesday. Thank you, Dr. Isaacson. Thank you, Dr. Niotis. Thank you, Taryn.